Hello, I'm Peg Bolgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. During our program, I will be focusing on the upcoming Vermont Great 2468K race and walk and how it will benefit the Foley Cancer Center's palliative care program. I will be joined by Tracy Moore, Director of the Rutland Health Foundation at Rutland Regional Medical Center, Linda McFarland, Certified Music Practitioner who works with palliative care, Dr. Alan Eisman, Foley Cancer Center Medical Director, Linda McKenna, Foley Cancer Center Director of Oncology and Palliative Care, and Eva Zivitz, Palliative Care Program Coordinator with Rutland Regional. I will be back after this message from Rutland Regional Medical Center.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.
Welcome back to Window on Wellness. I have with me Tracy Moore, who is the Director of the Rutland Health Foundation with Rutland Regional Medical Center. Tracy, welcome to the program. Always nice to have you.
Thank you, Peg. It's nice to be here.
And so I think we're going to kind of dive right into why we're here. We're here to talk about the Vermont Great 2468K race. So why don't you just tell our audience all the details.
Thanks, Peg. Really excited to talk a little bit today about the second annual Vermont Great 2468K Run Walk in support of the Foley Cancer Center at Rutland Regional Medical Center. This is the second year that Rutland Regional has hosted the race downtown. This year the race will start and end on Center Street in Rutland. Registration begins at 8:30 a.m. The race will start promptly at 10:30 a.m. Again, starting and finishing on Center Street in Rutland. There are different legs of the race. The 2K, a lot of our community walkers, folks of all levels and abilities, all ages. Oftentimes the 2K, the 4K are very popular for our walkers. We also have a 6K and an 8K option for folks who might be more interested in fast walking or running the race. We have a number of people who have already registered, and folks can do that by going to www.active.com. The cost to participate is $25 per person in advance of the race. So now, between now and September 14th, people can sign up. $25 per person.
Okay.
The cost to participate the day of the race is $30.
All right, and I think there was some incentive for folks to sign up early.
Yes, so we have created a really fun t-shirt, and the first 100 participants, the first 100 registrants really, will receive the free t-shirt. In addition, we have a really nice race, a wicking t-shirt that will be available for sale for some of our more serious runners, walkers who would enjoy having a new shirt. That shirt is available on sale through the Active website, and we will have shirts available for purchase the day of the race.
All right, excellent. And so let's go back. We know the race, the proceeds will benefit the Foley Cancer Center. But in particular, there is one program that will benefit from this, the palliative care program. So can you please explain to us a little bit about palliative care and what that means?
Sure. Thank you. So as you said, the Foley Cancer Center is the beneficiary of the race, specifically the palliative care program, which provides support to patients who have been diagnosed with a chronic or serious illness, oftentimes life-threatening illness. We have physicians and staff at Rutland Regional who work to support patients and their families who are dealing with what the next phase of life looks like for them, what kinds of supports are helpful in their everyday life. and all proceeds from the race will support these efforts.
Excellent. And is there anything different about this year's race versus last year?
So a couple of things that are different about this year's race, Peg. The start time is different. As we are finding out in Vermont, our summer weather is extending through the fall. Last year, we had a very hot day. So we have moved the start time from the afternoon, as it was last year, to the morning, thinking the temperatures might be a little bit cooler for folks. Oftentimes people like to get their run or walk in earlier in the day. So again, the registration will be 8:30 a.m. with a 10:30 a.m. race start. And we will start and finish on Center Street. And that is a little bit different from last year. The race route has been simplified somewhat, so we are right in the vicinity of downtown Rutland.
Okay.
Each leg of the race will take you through the city and bring you back to Center Street, where we're hoping to have the street lined with folks cheering our finishers on as they come across that finish line.
Well, that'll be a sight to see. I remember last year it was such a festive event. It was hot, but it was festive.
We were so pleased last year, the outpouring of support from our community at every level, from our corporate sponsors to the downtown businesses to the local community members who came out to walk in support of the Foley Cancer Center. It was really nice to see so many people there, and I think a nice opportunity for folks to just relax and enjoy the beautiful weather together.
And let's talk about some of the other activities that are going to be going on that day downtown along with the race.
We have a full day planned, really a downtown day for locals, for visitors to the region. In addition to the Vermont Great 2468K, there are a variety of activities happening on Center Street. Come Alive Outside will again place sod on Center Street, which will create green grass, natural play space for children and families, collaborating with Wonder Feet Children's Museum to provide some different activities for folks just to come out and enjoy the day. Tom Joyce, a local magician, will be providing a magic show between 12:30 and 1 o'clock. Tom is always a huge draw. Children and families enjoy his show. He'll be a part of the afternoon. We have folks who are participating in the 100 miles in 100 days program. They will have the opportunity to finish their last mile as a part of the 2468K. So some fun activities around that, some yoga, some stretching, hopefully some massage for folks who are participating in the race. And even if you're not, just a fun time to come down and have some of those services. And we're really hoping that people will enjoy the Vermont Farmers Market that'll be happening. Stop in, check out some of the unique shops and restaurants along Center Street and in downtown Rutland. And at 2 o'clock, the Shriners will be doing a parade through the city of Rutland that will end right by Depot Park with some festivities planned there for after the parade. So really a full day. The Shriners will be bringing many people from outside the Rutland region to the community. So really just hoping to have a nice community day with lots of different things happening for people to enjoy.
Well, it sounds like a full day, but a fun day.
Full day, but a fun day,
Definitely.
for sure.
And so did you want to give a shout out to some of your sponsors for the race?
I would love to do that. Thank you. Again, this year, our presenting sponsor is Carpenter and Costin. Of course, Russ Marzin, Matt Cataldo, very involved in the Rutland community and a big part of the day. They've been a big part of the race for the second year. I'd also like to mention our gold sponsors. which include Back on Track Physical Therapy. We have Killington Pico Ski Partners, and the VNA and Hospice of the Southwest region. In addition, WJJR Catamount Radio has signed on as our media sponsor this year, and we have Hannaford Supermarket as our refreshment sponsor. We are still in the process of following up with sponsors in our community, so we expect this list to grow over the next couple of weeks, and we'll keep the community posted on those new additional sponsors.
All right, excellent. And any final thoughts, Tracy, before we close out our interview?
I think, as always, just really the chance to thank the Rutland community. We talk a lot about the fact that Rutland is such a giving community. They're so interested in supporting the well-being of our community members, and we are always very appreciative of the support that we receive for programs at Rutland Regional Medical Center. The Foley Cancer Center specifically, the center, the patients benefit greatly from the support that we receive from the community. And this race is just one more opportunity for folks to support the hospital and the Foley Cancer Center.
All right, well said. And we certainly encourage folks to please sign up for the race now, www.active.com. And thank you, Tracy, for joining me today.
Thanks for having me, Peg.
Well, welcome back. I am very happy to have as my guest Eva Zivitz, who is the Palliative Care Program Coordinator at Rutland Regional Medical Center. Eva, thank you so much for being part of the show today.
Thanks for having me.
So why don't we get started, and what is palliative care?
So palliative care is something that most people don't understand. It's often the first thing that I have to explain when I go into a room and meet a patient and their family. The way I explain it is to say that to palliate means to comfort, and that's interpreted in any way that a patient and their family need. Oftentimes, we work to make someone comfortable with physical problems like pain, shortness of breath, nausea, but many times patients and families need to be comfortable understanding medical information, understanding their options and their resources, and they may need some help feeling comfortable expressing what their wants and needs are as far as what we're trying to do for them, what their goals of care are. So palliative care encompasses all of those things. Our job is to make the patient and family as comfortable as possible in any given situation.
So how long has the palliative care program been in existence at Rutland Regional?
The hospital hired me in March of 2005, and we spent about 6 months doing some research before we saw our first patient in October of 2005. So 13 years.
Wow. So how many patients go through the palliative care annually at Rutland Regional?
Each year we've been growing, and this year the data that I have makes it seem that we may top 1,000 patients this fiscal year.
Wow.
So quite a number. We're one of the busiest palliative care programs in the country.
Oh my goodness. So in addition to cancer care, what other life-threatening and chronic medical diseases does the palliative care team address?
Anything. The way that palliative care is often defined nationally is care for patients with any serious, chronic, or life-threatening condition. And I think that "or" is very important to stress, is that someone doesn't have to be dying or near the end of life to qualify for palliative care. We wouldn't typically see someone who came into the hospital for, say, a hip replacement or a simple pneumonia, but if someone has chronic illness like cancer or heart disease and came in just because of a broken hip, we may definitely see that person. So it really depends on the situation and the needs of the patient and the family.
So how long does a typical palliative care last? Can it months, years?
I've been seeing a patient recently who I've been following for 6 years. Okay. So one typically thinks of hospice and palliative care as very similar, although they aren't always. And with hospice being definitely towards the end of life, palliative care is not. Patients can have any prognosis, so we might see someone early in their disease trajectory and follow them for many months or even years.
Okay. And so are there other aspects of the program that you wanted the community to be aware of around palliative care?
I think the most important thing would be to stress that palliative care and hospice care are different. Both are important, especially for patients that do have life-limiting illness, but that to have a palliative care consult is not a message to the patient or the family that someone is dying. That palliative care is there to support them and make sure that they have all the information that they need to make the right choices for them. So it should be a program that's empowering to the patient and the family to help them live as fully as possible and make the most of whatever time they have, whether that's days, weeks, or years.
All right. Well, thank you very much.
Thank you.
Very much. Welcome back to our show. I have with me Linda McKenna, who is the director of the Foley Cancer Center, and she is going to also be talking a little bit about the palliative care program here at the Foley Cancer Center. Linda, welcome.
Thank you.
And so, who makes up the palliative care team at the Foley Cancer Center?
Here at Rutland Regional, our palliative care program is a nurse-led model. We have 3 full-time FTE nurses who are specialized, certified in palliative care and hospice, and they are integrated into the patient's medical care team as an adjunct. So they don't replace anybody, they're an addition to the medical care team.
So Linda, can you share with our audience some of the complementary therapies that are available
Sure.
at Rutland Regional Medical Center?
Sure. We have a number of different therapies here. First off is the Care Channel, which is on every television in the entire building. That's relaxation and guided imagery, and that's throughout the building. We have animal-assisted therapy, and those are certified dogs and their handlers that come and they visit, every unit throughout the building in this hospital. We also have an acupuncturist, Glenn Harder. He primarily works out of the Cancer Center. He's here Wednesdays and Thursdays. It's a free service to the Cancer Center patients as well as some of the inpatient palliative care patients as well. And we also have the pleasure of having Linda McFarland, who's absolutely fantastic, and she plays throughout the entire building on all the floors, including the intensive care unit. And it's just remarkable, the comments and the outcomes that we get from her therapy.
Excellent. And so are there other aspects of the palliative care program that you wanted to share with the viewing audience that you think would be important for them to know?
Well, one thing I'd like to stress is that palliative care shouldn't really be associated with death and dying, which some people often think of it as. It's really about living today, and it really is a focus on the whole person. Mm-hmm. The medical care team is there to focus on the patient. The palliative care nurses really focus on the whole person and the patient. The medical care team, as I said, focuses on the disease, whereby the nurses focus on the whole patient. 2 real main issues are that of really, how are you feeling? They're interested in the symptoms the patients are having, pain, shortness of breath, nausea. They work with them with that. But then the other issue really to focus upon is what are you thinking about? What can they help you with? Socially, emotionally, spiritually. It's really more focusing on living today, living tomorrow, really forward thinking, and focusing on the whole person, so medically and emotionally.
All right. Thank you very much, Linda.
Okay, you're welcome. Thanks for having me.
I'm very pleased to have with us on the program today an old friend of mine, Linda McFarland, who is a certified music practitioner, and she works with the palliative care program at Rutland Regional Medical Center. Linda, it's so good to see you as always.
Hi, good morning, Peg.
And so why don't you just explain to our audience about your role at the hospital and with palliative care, along the stuff you do with the music therapy.
Well, what I do is I provide bedside music for patients, and I meet their immediate needs. depending on their condition. They might be ready to be discharged, might be somebody who's here long term, could be a patient who's actively dying. So I assess the patient from the information I get and when I walk in the room, and I play music according to their needs. And it's to help promote personal healing, whether it's spiritual, emotional, physical, provide comfort to the patient, those who care for them, those who love them might be visiting.
So how long have you been doing this?
I've been doing this for over 4 years, and I've been at the hospital, I think, for 3 years. And I work through palliative care. I provide music in the Foley Cancer Center, on the floors, and in the day room.
So typically when you work with patients, is it one-on-one, is it in a group, or both?
Mostly it's one-on-one. That's when I go into a patient room, and I'll sit next to the bed, and I'll play music for the patient. I let the patient know if they don't want music, they can always refuse and say no. Many times the music helps relax a patient, and they might fall asleep, and I let them know beforehand that it's okay to fall asleep, and then I'll quietly leave the room if they're sleeping.
And is it an ongoing process? You know, I mean, for example, you know, do you do it once? Do you do it numerous times with patients? I mean, how does that work?
I get a patient list through palliative care, and there are some long-term patients that I'll visit quite frequently, so they know what to expect. Sometimes I'll see patients in the Foley Cancer Center when they're getting treatment, and then I might see them on the floor in their room. So they already know who I am, so that's a plus because, you know, they're more comfortable with me when I'm in their room. So there are some patients I might see once, and there's probably a patient I've now seen probably 25, 30 times. Yeah.
So there must be some direct medical benefits.
Yes.
To this.
Yes, there are studies that have shown the medical benefits of live therapeutic music. Can help reduce blood pressure, help the patient become distracted from their environment to help them relax a little bit. I've had patients tell me the visions they see when the music's playing, that they fall asleep. If a patient's on a monitor, sometimes you can see what happens, like with their blood pressure or their heart rate, and it's pretty amazing.
That's great. So obviously it's a very, very important piece of the palliative care program at Rutland Regional, and they're so glad they're lucky to have you.
And I'm happy to be here. It's so nice to be able to provide this service for patients and their families.
So can you give us a demonstration?
Absolutely.
Of what you do with the patients, some of the
Yep. So
music?
this instrument is a mountain dulcimer, and this is the one I primarily use when I do bedside music. I also play guitar and ukulele. Usually I use the guitar and the ukulele in the day room. But this is what I'll play when I'm in a room. And I'll be playing a piece called Ocean Sunrise.
That was beautiful, Linda.
Thank
Thank you
you.
so much for being part of the program.
Oh, thank you. I'm glad I could be here.
Welcome back to Window on Wellness. I'm very pleased to have as one of my guests today, Dr. Alan Eisman, Medical Director of the Foley Cancer Center. Dr. Eisman, welcome.
Thanks for having me.
And I know that during the show we're going to be talking a lot about palliative care. And so I just wanted to kind of, ask you some questions. And I wanted to start with, does palliative care help patients make decisions about living with a chronic illness?
Palliative care is really important for that very purpose. And even from stepping back for a minute, it's important to remember that palliative care really sees the person beyond the disease. And the focus is on the management of symptoms and symptom relief from a serious illness. So patients who have a serious illness often think of their medical treatment and their medical care, treatment options, the prognosis, the future, and they're discussing that with their family. So they're having to think about and make very complicated medical decisions. And palliative care is designed to be a support for helping make those decisions.
Okay, so how does palliative care help patients prepare for end-of-life decision and a transition to hospice care? I know you were starting to talk about that earlier.
So there's a long continuum when someone might have a serious illness. And that can be from the beginning stages when someone is newly diagnosed, or the course over time of having that illness and living through it, being treated for it, living with their family who's helping to care for them and seeing changes that occur. And sometimes there is no good or effective treatment that remains, or even if there is an effective treatment, it may be that a patient is tired of treatment and doesn't want to pursue additional treatments, or the side effects might be too risky or too challenging. And at that point, if a patient is no longer interested in having active treatment, but still needs symptom relief and the relief of stress from a serious illness, that would be an appropriate time to think about hospice and end-of-life care.
And so what are the benefits of palliative care for the patient and for the family?
So palliative care is really a specialty of medicine now that is designed to focus on symptom and stress relief of serious illnesses. And it's made up of a dedicated group of professionals whose skill set sometimes is most important when it comes to communication. So the communication of information between the healthcare team and the family and the patient is what helps the patient have control over their understanding and decision-making around these very important decisions around the end of their life or around their serious illness.
And one other thing I wanted to ask is, are there any other aspects of the program that are important for the community to understand as pertaining to palliative care?
So palliative care is really a support for the main medical care that's being provided. It's a specialty, and it's made up of physicians, advanced practice providers, nurses, other healthcare people, but their purpose is really to provide a support to the main attending physician in the hospital or the patient's primary care physician or other specialty physicians who are directing the main medical care of the illness. But it's a collaboration between palliative care and the main medical care together to provide this additional layer of support for patients who are making decisions about what they want to do with their health care.
And did you have any final thought that you wanted to add, just about the palliative care program at Rutland Regional?
The palliative care program here at the hospital is run by very dedicated, interested, and skilled nurses who provide care 7 days a week, available 24 hours a day, and their interest is really in and their focus is on the quality of life for patients and families.
All right. Well, thank you very much, Dr. Eisman.
Thank you.
Thank you for joining us today. Please continue to watch Window on Wellness each week on Peg TV Channel 15 and also on demand at pegtv.com.